Good evening. Now we are looking at various formats that you need to prepare and its applicability. Now, once when a patient comes to you and you are sure that this patient can be treated at your hospital, you can get this form filled in. Make sure that even the consent which is associated is also a part of it. Initial medical assessment needs to be done preferably by a treating doctor. In case if the treating doctor is busy or not in the hospital, the RMO or any other medical practitioner can do this. However, needs to be signed by treating doctor, and a plan of care and the estimate has to be prepared and to be handed over or to be discussed with the patient or their relatives. Initial nursing assessment, in case if you are not sure about the competency of your nursing staff, you can eliminate this form. However, it's good to do this initial nursing assessment so that nurses also feel included in the part of treatment. You can teach your staff about how to fill this form. It's not very difficult. My sincere advice is that you should get this done. Treatment sheet, I'm sure you will have treatment sheet, PPR chart, both of which you will have. In case if there are no columns for date and time and the other parameters as in our format, you can use your existing format without changing it. Nursing over nursing notes, again same, depending on the competency of the nursing staff, you can decide this to have or not to have. However, good idea to have it, and especially for ICU setup, it's almost mandatory. Feedback form is optional, completely optional. You can have it or you don't need to have it. It's up to you. Same thing about the home care. It's completely optional, but especially when there are post-surgical care that needs to be taken, post say cataract or CABG or some other like obstetrics after delivery. It's good to have some do's and don'ts about the care. So it's good idea to have this made. Discharge summary needs to be filled in absolutely as per the format given to you. Please don't variate it much. Consent for anesthesia needs to be done for all the surgical cases. What you can do is, because many times in nursing homes, the doctors don't come, the anesthetists don't come a previous day for the surgery. So the fitness or the other investigations are summoned by the surgeon. So that is file acceptable. However, it has to be signed by the anesthetist before the beginning of surgery. Consent for surgery absolutely required, to be signed by the surgeon. Consent for HIV testing, normally for a surgical setup where most of the people do this HIV testing. For such scenario, I would advise you to put this in your initial consent, admission consent, so that you don't need separate consent for this. Consent for surgical procedures, whenever you are doing any bedside procedures like fluid tapping, catheterization, this needs to be done. Next, forms like pre-op checklist, WHO checklist is an essential part and has to be done. The surgical checklist has to be signed by all the three concerned people, that is the surgeon, the anesthetist, and the washed up nurse. Pre-anesthesia evaluation, again as I said, anybody can do it, however needs to be signed by the anesthetist. Anesthesia monitoring has to be essentially signed by the anesthetist. Operation record has to be essentially done by the surgeon. Patient and family telecommunication, this depends on, for For a ICU setup, it is absolute requirement. For non-ICU, it's optional. Of course, I know every doctor communicates with the patient or their relatives every day, however, not documented. In today's scenario, it's better to document all the communication that you make with the patient or their relatives. Blood transfusion and blood monitoring absolutely required. Now, even if you are reserving a blood for surgery, please get the blood transfusion form signed by the patient. Consent for DAMA, yes, required. This can be a part of your no. This needs to be signed by the concerned patients and their relatives. High risk surgery, whenever the surgeon feels that this patient may develop some problems, it's better to get this form signed up. In case if it's going to be a very recurring feature, then this form, this particular items of high risk elements can be included in your surgery consent and get it done. It's better whenever patient is leaving your hospital for investigations and coming back after a while, since he is not going to be in the hospital, and you should not be held responsible for anything that happens en route or at the place where the patient is going. It's better to take a traveling consent and make a note of exit time and inward time in the patient's record. MLC and intimation, a must for all MLC patients. TMT consent for all treadmill patients. Diabetic diet instructions recommended for ICU and medical setup. However, it's your call. Consent for refusal of admission and MLC. Actually speaking, this has no legal standing. As long as the suicide is a crime, a patient cannot decide about the refusal of admission or the MLC. You cannot take the consent. However, the consent for refusal of admission and MLC are not legal, but this, when you get it signed, it puts a psychological pressure on the patients and the relative mind that we have signed now, how can we go back from our words? BiPAP, if you are putting a patient on BiPAP, whenever you are restraining a patient, maybe a physical or chemical is sedation. So whenever you are sedating a patient, or whenever you are tying up a patient for physical for various reasons, then this form needs to be signed. Death summary, of course, very clear, self-clear. Consent for transfer, better to get it done. Declaration of medical history. Many doctors had this issue that patients initially tell something and then afterwards they पूरा पलटी मार देते हैं. They kind of change their claim and they say we never told you. You have probably misunderstood it. So, a lot of doctors prefer to take this medical history in writing from the patient, so that there is a clear-cut declaration by the patient that these are my pre-existing diseases, this is my from this date and whatever. So, the medical history is completely acknowledged by the patient. Dialysis, transfer or referral, whenever you are referring a patient or transferring, this can be a register also. Instead of a form, you can opt to go in for register as well. MRD checklist for all the patients' record. This should be the first page. Cleaning schedule, of course, we need for 3 locations for putting up on the website.
This video is brought to you by Team Guidence for training purposes. For more such videos, please contact us. Thanks for watching.